digestive system. The gastrointestinal tract, the alimentary canal, consists along tube through the which the food passes the start from the mouth and in his anus. The different part are mouth, pharynx, esophagus, stomach, duodenum, small intestine, appendix, large intestine, rectum, anus. Third appendix is a vestigial organ. Is human is the considered appendage human digestive system from the elementary standpoint of view. First में parotid gland, pharynx, esophagus, liver, stomach, gallbladder, duodenum, pharynx, small intestine, large intestine, appendix, rectum, anus. Organ of the digestive system. Associated gland: mouth, salivary gland, stomach, duodenum, gastric gland, liver, pancreas, small intestine gland. Structure of GIT: the wall of the alimentary canal are formed by four layers of the tissue from inside to outside of tube. They are mucosa membrane, tunicomucosa, submucosa, tunica submucosa. Muscular layer: tunica muscular, series of peritoneal layer, tunica adventitia of serosa. Serosa, longitudinal muscle, circular muscle, submucosa mucosal muscle, mucosa epithelium, lining, lymphoid tissue, mucosal gland, submucosal gland. Mesentery: general outline of the alimentary canal. Mucosa membrane: this layer of three division. Hi. Hello. बोले. I am reading anatomy. So membrane. This layer has three divisions. Stratified equivalence of single columnar epithelium. Lamellibranch, which is delicate alveolar connective tissue, and lymphoid. Sorry. Where are you from? Hi. Where are you from? Okay. Muscular mucosa: in a thin layer of throat, mouth, muscle, and the form boundaries between mucosa and submucosa layer. Submucosa, tunica, submucosa, the consist of the loose area tissue with some elastic fiber, blood, capillaries, lymphatic vessel, nerve flex. Muscular of tunical muscular areas, the consist of mouth muscle arranged in layer in the inner circular and outer longitudinal layer. Between these two layers of muscle there are blood vessel, lymph vessel, and autonomic nerves. A wave of alternate contraction and relaxation of muscle is called the peristyle. The peristyle assists of onward propel of the content of the canal. The other movement of the intestine help to mix food with digestive juice. The content point of the circulation muscle are we developed into series of peritoneal layer. It is the fibrous outer coat that carries large blood vessel and nerves. Then the organ is covered by the peritoneum. This layer is called serosa, otherwise tunica adventitia. Nerve supply of the GIT and supplies the autonomous nerve tracts. Peritoneum, the largest serous membrane of the Body two layer, parietal and visceral layer. The parietal layer line the near surface of the abdominal cavity. The visceral layer of the cover the most of the abdominal viscera. The between the two layer of the peritoneal cavity there is the potential space which contain peritoneal fluid. Peritoneum is divided into three parts: omentum, greater, lesser, mesentery, peritoneal ligament. The greater omentum is long double fold of connective tissue set the extend inferiorly from the stomach drops over the transverse colon and coil of the small intestine. Large quantities of the adipose tissue accumulate which appears like the fatty apron. It is the four layered. The lesser movement has two fold which connect the lesser curvature of stomach of liver and diaphragm. The mesentery outward of the peritoneum which associated with the small intestine peritoneal ligament. The falci of the ligament attach the liver to anterior abdominal wall. The mesonom bind large intestine and posterior abdominal wall. The pelvic peritoneum contains both round ligament of uterus. The mouth of the oval cavity is buccal cavity is bounded by muscles and bone. The relation are anterior the lips, posterior open the oropharynx, laterally muscles of chest, supply bony, soft hard plate, interior tongue, mouth, gingiva, gum, lips, hard plate, soft plate, platelin, tonsil, uvula, papillae of tongue, molar, premolar, canine, incisor. Oral cavity. The lips is covered by the skin externally, the internally by the mucosa membrane. Between the skin of mucosa membrane is zone called vermilion. Lips are attached to gum by the labia primula. Oral cavity is lined by the stratified equimocal epithelium. Hard plate is formed by maxilla and the plateau bone. Uvula is the fold as muscle of the language down the posterior part of the soft plate and anterior side of the uvula. They are the platinum, tonsil, lymphoid tissue, teeth, tongue, salivary gland associated with digestive system. Teeth. They are the embedded in the alveoli of the mandible and maxilla. They form synovium joint of the gomphosis variety. Each person has to set two teeth, temporary, permanent. Teeth, enamel, dentin, gingiva, gum, pulp cavity contain blood vessel and nerve, periodontal ligament, root canal, bone. The section of tooth, temporary teeth are 20 in number, 10 in each low. They are begin up to 6 months old. Permanent teeth replace them 6 years and complete by 24 years. Human dental formula 1, 2, 3, 32. Premolar or molar. Function of incisor canis, cutting of food, canis, tearing of food, premolar or molar, grading of food. The structure of teeth. Each tooth has a crown, neck, and root. The crown consists of one or more cubes. Teeth is fixed into alveoli by root. It is the fixed of the cement like the substance called centenum. In the center of the teeth Pulp cavity present in the content periodontal nerve and vessel supplying the teeth. Surrounding publicating dentine of present on the crown. Dentine is covered by enamel. It is the hardest substance of the protect the tooth from the acid from the bacteria. Food and bacteria. The tooth is fixed of mean of the periodontal ligament. Teeth are supplied by upper jaw teeth, maxillary nerve, lower jaw teeth, mandibular nerve, maxillary mandibular nerves, branches of trigeminal nerve, tongue. Tongue is the voluntary muscular organ covered with mucosa membrane. It is situated in floor of the mouth. It is attached by its root to hyoid bone and by the fold of its mucosa membrane covering called frenulum. It contains numerous papillae which contain taste buds. Taste buds are the sense organ taste. There are three types of papilla present. The filiform pellic. These are the pointed, the thread-like. They are distributed cover over the inner surface of the tongue. The fungiform papillae knob like the elevated attract the cover over the inner surface of the tongue. Circulated papillae is largest type of the circular. They are the arranged in the form of an inverted V. Test tubed inlined by the stratified squamous epithelium and the flat like with the wide the bottom. The test hair they wear the short of the nerve neck the each test bud. Test bud contain melon shaped test cell. Nerve supply sensation of the carries of the showed tympanic branch of the facial nerve of the glossa, pharynx nerve. General the sensation of the tongue of the penis, the temperature, pressure of the carotid, the triangular terminal nerve, the muscles of the tongue, pepper the hyposol nerve. The lateral glossoping fold, epiglottis, peltagross arch, epiglottis vesicula, and the tonsil, the terminal surface of the tongue, formation section of tongue, body of tongue, apex of tongue, medium sulcus tongue, velate papillae, foliated papils, root of tongue, platinum tonsil, structure of tongue, the function tongue of the mastication, tongue help the chewing of food material, deglution help in the savoring of food material. It is the chief organ of taste. It help in speech, in help in maximum the food well with salivary gland. There are three pair of salivary gland: parotid, submaxillary, sublingual. The parotid gland opens into inner surface of cheek opposite to second molar tooth by a single duct called ductal station. Function they are the secret saliva, secreted in the composition of the saliva. Total amount the 12,000 to 15,000 ml 24 hour. Consistency of the slightly cool due to cell the measuring pH of the acidic specific gravity composition water 99.5% solid 0.5% solid cellular constituted in inorganic salt organic substance cellular constituted yeast cells to NaCl enzyme bacteria sodium phosphate mucin polymer of CaCO2, urea, amino acid, epithelium cell, potassium thiocyanate, calcium phosphate, calcium in the enzyme present in the saliva in convert cooked stage, maltose, the mechan the machines of salivary secretion, pons medulla, parasympathetic, salivary gland, sympathetic, T1 T2 segment. Then parasympathetic fiber of the salivary gland are the stimulator for veterinary saliva is the secreted. Then the sympathetic fiber causes less than secretion of the saliva which thick reach the mucus. Pharynx, muscular membrane tube for the respective purpose is divided into the pharynx, nasopharynx and the laryngeal pharynx. It consists of three layers. Inner layer composed of the static field, epithelium, medial layer, fibrous tissue contain blood, vessel, and nerve. Outer layer number of the involuntary muscle, which are the involved with swallowing blood of the blood supply the cerebral branch of the facial artery.